Well, it hasn't been long since we last talked to Dr. Janet Memark about COVID and Cobb, but it seems like everything has changed since then. The trees are blooming, new vaccines are coming, different kinds of vaccines are coming. More people will soon be eligible to get the vaccine. So, Dr. Memark, have we turned some sort of corner?
There definitely is that feeling that, I think we all got some hope, especially with the warm weather and everything going on outside. We continue to see numbers coming down. The only caveat I have for that is that we have just been alerted of a delay in electronic reporting. We're a little nervous about how that's going to affect our numbers. So I just want to make sure everybody knew about that. You may see numbers that will start to shift a little bit because they're going to backload some of the results that didn't get in there. So we're seeing those come down. We are seeing our hospitalizations come down. We're very excited about all of those things. But deaths continue to keep creeping up on us, and I would love for us to see a halt to that. But we're up to 950 deaths right now that the county has had. And we're about 339 cases per 100,000, so getting closer to 3 times high, but they are going in the right direction as of now.
Yeah, with all that information coming in about the new vaccines and new schedules and new people eligible, how do you sort all that out?
So that's a great question. So right now we've done almost 2.5 million vaccines in Georgia. That's pretty good. So in Cobb County, it's almost 150,000 vaccines. So good news on that front. That is going forward. So we have several vaccines on the market right now, right? You have the Moderna and Pfizer vaccines, which are the mRNA vaccines that have very good effectiveness. And then we have the new Johnson & Johnson vaccine, which is a DNA vaccine. So that one's that one-shot vaccine, which I think a lot of people like. There's some question about the efficacy of that. It's a little bit lower. It was over 70% in the United States, but the hospitalization and death efficacy was phenomenal, near perfect. And so that's really the most important thing, and you have that in all 3 vaccines. So, someone may get a minor case of COVID, but your risk of getting hospitalized and dying from it is very, very low, and that is what the most important thing. So we don't know who's going to have what vaccine. We don't know what vaccine we're going to have sometimes. So our advice is whatever vaccine you can get, take it. That's really the most important thing right now, because if you're going to pick and choose, it may be a little bit harder. So Johnson & Johnson came out this week to the state of Georgia, and the governor has been allotting those for educators for the first batch. So you will see people who will have plans to vaccinate the educators and staff. They're getting the Johnson & Johnson vaccine oftentimes. And then the other vaccines continue to just kind of spread to more and more providers to be able to vaccinate.
A lot of folks were on the outside looking in when it came to the possibility of getting vaccinated, but within a few weeks, pretty much everyone will be eligible.
So now we have a lot of folks that are being included into this eligibility. So we have the original group of folks that included the nursing home folks as well as healthcare providers and public safety. And then we added on the 65 and older folks, right? And then this week we added the educators, and we have adults with intellectual and developmental disabilities and parents of children with medically complex conditions. So on Monday we add on a whole nother group, which is anybody age 55 and older. And then also if you have disabilities and certain medical conditions. So disabilities, you can take a look at those conditions, but medical conditions, this is going to include a lot of folks. So including if you have diabetes and hypertension and heart conditions, but also things like even just being overweight and being obese will fit you into this category. So you can go on to DPH's website to see all of the specific conditions that are included. But starting Monday, we'll have millions and millions of folks that are going to be added on to the criteria.
Yeah, millions and millions. You heard it. So with the vaccine being so scarce and difficult to receive in recent weeks and months, can the system handle it?
So, that's something that I kind of asked myself as well. So the one thing that we do seem to see that is that you see different availability of vaccines kind of differ in different places. And not only do we have our state supply of vaccines, but we actually have federal supplies of vaccines coming in as well, which is really good news. And so what you're going to see is you may not get it at the one location that you want to get it at, but if you broaden your scope a little bit, I'm seeing a lot of folks that are getting vaccines all over the metro. And so I would not be wedded to one place, but you can go ahead and look across different areas to see who has a vaccine. And then also the GMA sites as well. So now we're going to have 9 GMA sites that will do vaccines, like 1,000 a day. And that's coming from the state supply as well. But then you have federal vaccines are going into a lot of pharmacies. So I looked today and we have 143 providers just in Cobb County that can give the vaccine. And Cobb and Douglas Public Health is only a small portion of that. So you see a lot of these vaccines that are going, and then they'll be getting more and more vaccines as it comes out. So just kind of broaden your scope and don't just rely on one place to look. But you can also look at the GMAS registration site and the state DPH vaccine locator, and you can find different people that have the vaccine.
I'll put links to a lot of those vaccine locator sites in the description to this video. There's also been some big news when it comes to what you can do once you've been vaccinated plus 2 weeks. Do you even need the masks anymore?
Yeah, so that's some good news. Everybody's really excited about that one. So people that are vaccinated, fully vaccinated people, which means 2 weeks after either your second dose of Moderna or Pfizer, or 2 weeks after your Johnson & Johnson. So now fully vaccinated people can meet without wearing masks and socially distancing, and they can meet in groups. So that's great news. We're increasing our social circles here. And you can also meet with unvaccinated folks in like the same family groups, as long as there's not people that have very high risk conditions. So I would not go, because there's always a 10, it's going to be 5 to maybe 20-something% risk that you won't be covered by the vaccine. So I wouldn't go visit someone who is actively undergoing chemotherapy. That's really not the best thing. You're putting them at risk. So that continues. So if you do that, you're going to really be very cautious about doing something like that. But if you visit other higher risk people, make sure you wear your mask and keep your distance, or be outside as best you can. So you can do those things, and you don't have to quarantine or isolate anymore. So that's great news too. And so actually, you don't have to quarantine. You still have to isolate. So if you get your high-risk contact, you don't have to quarantine if you are fully vaccinated. Now, please remember, there is still a 5% to like 27% risk that you could still get COVID. And so it's very, very important that if you develop any symptoms during that quarantine time, or if you've been exposed to others, you really need to quarantine at home. So do not go out symptomatic, vaccinated or not vaccinated, because there is still a breakthrough rate that you could still get COVID.
Well, always with Dr. Memark, there's some caution, there's some little bit of worry, and she worries about the variants and worries about another increase in spread and worries that people will take their guards down too soon.
So things that we're worried about right now. So definitely we're trying to get vaccines, as many vaccines as possible, into arms, and that's a collective effort that we're all doing. The other thing is that we continue to see an increase in the number of variants in the state of Georgia. Please, if you get a chance, visit that CDC website, and you can see the map, and you can see our neighbor Florida is just exploding with variants right now. We are seeing an increase ourselves. The last time I checked yesterday, we had 171 of the UK variant in the state of Georgia, and we also have 3 of the South African variant. So please, we have these variants that are, remember, this is a very, very big undercount of these variants. So they are actively circulating, right? And they have the potential to be highly contagious and to be more deadly than what we're seeing now. We are in a good place right now. Please just get there a little bit longer of doing our prevention so that we can beat back these variants. If they take a hold, we're going to be in a lot of trouble. So please do your best just to continue on with this just a little longer. We have hope, and we're making some progress. So please.